next video that I would like to do with you is on blood vessels. It is a specific video for a specific class, and so I'm glad you're here. Please keep coming back, but remember that this is kind of an abbreviated video. Do what your teacher wants you to do. I usually try to get my students to highlight material, and that is what is tested on the test. This is just a review to help a brother and a sister out. Here we go. Let's talk about the tunica intima. Is the tunica intima the inner layer of a blood vessel or the outer layer? Inner. Yes, you're right. Almost said it wrong. It's the inner layer, which is called the endothelial layer, by the way. It's the same as the inside layer of the heart. We learned that the tunica media can have up to 40 to 70 sheets of elastic fibers. Interesting how this works. What is another name for the tunica externa? It is called the tunica adventitia. Which vessel seems to have a thicker tunica media? Is it an artery or a vein? Artery. An artery. And what feature do veins often have that arteries don't have?
Valves.
They have valves, and that keeps backflow from happening. We learned also that baroreceptors and chemoreceptors are located in the carotids and the aorta to help monitor pressure changes and chemical changes. This can feed back to the brain to make changes to respiration and heart rate and so forth. What artery is occluded in a blood pressure measurement? Right, is the brachial artery. Remember that skeletal muscles, like your calf muscles, when you walk, also aid in movement of venous blood back toward the heart. What is the normotensive state for blood pressure? What are the numbers for that? 120 over 80. And if we have over 160 and over 100, what level of hypertension would that be?
Stage 2.
It's called stage 2 hypertension. Thank you. Capillary net filtration pressure is an equation used to determine if liquids are being pushed out or being sucked into the capillary. If, for instance, the hydrostatic pressure was 50 millimeters of mercury and the colloid osmotic pressure of the proteins was 10, 50 minus 10, what would the net outward pressure be? 50 minus 10 would be 40 millimeters of mercury. If the value was negative, what would that indicate? It would indicate that water is being sucked into the capillary and not being pushed out. We learned too that edema, especially in the lower limbs, is something associated with circulation that is not working as it should. Could be a sodium imbalance. Water is not being evacuated from the tissues properly, one way or the other. Which one of these is thought to be due or known to be due from a protein deficiency in nutrition? Is it kwashiorkor or ascites? It's kwashiorkor. Ascites apparently is due to a lack of albumin produced by a liver that is not functioning properly. Okay, let's talk about what comes first, and let's talk about reasons when it comes to the vessels, and that might get us ready for our test, possibly. Which comes first in the aorta? Is it the ascending, the arch, or the descending aorta? Which comes first? It is the ascending aorta. In the arch itself, listen to me, is it the left subclavian, left common carotid, or the brachiocephalic trunk that comes first? It's the brachiocephalic trunk, then the left common carotid, then the left subclavian. It goes like that. Thank you. Listen to this and tell me where it is located. Superior mesenteric artery. Is it in the abdomen? Is it in the thorax, the chest, or is it in the thigh?
Yeah.
It is in the abdomen. It is listed under abdominal aorta branches. Thank you. Very nice. What about the anterior tibial artery where we would take the dorsal pedis pulse? Is that on the forearm or is that on the leg? It's on the leg. Let's talk about the circle of Willis for just a few minutes. What are the two vessels that unite to form the basilar artery, which is kind of heading toward the circle of Willis. They are the vertebral arteries, all right? What is the name of the artery that is the continuation of the internal carotid artery? It is the middle cerebral arteries, and they go to the side of the brain. If we're talking about veins, coming from the subclavian vein and heading back to the superior vena cava, which comes first? Is it the external jugular vertebral vein or internal jugular?
External jugular.
It is the external jugular. Thank you. Listen to this and tell me what you think. Superior, inferior mesenteric veins, gastric veins, splenic veins, all of these empty into one big vein that goes to the liver for detox. What are we talking about?
Hepatic portal vein.
That is hepatic portal vein. Just made another video on that last night. Please check that out. Artery versus vein, inferior and superior mesenteric artery video, in vein video. Let's talk about veins in the arm. Do the radial and ulnar veins form the brachial vein, or do they form the subclavian vein immediately?
Brachial vein.
Immediately they form the brachial vein. Eventually that empties into the basilic axillary subclavian. That's kind of the path back toward the heart. Let's talk about the great saphenous vein. Where is the great saphenous vein located? Is it in the thigh or in the leg?
The thigh.
You say in the thigh. I believe it's in both. If you look at the picture, it is draining the leg and the thigh, and then it merges with the femoral vein in the upper thigh or groin area. Remember, we have a pathway of artery to arterial to capillary to venial to vein. That's kind of like the long throw down from big to little to tiny to little back to big again. This concludes our review of the blood vessels. It is not exceedingly comprehensive, but just meant to kind of give you an idea of how things might roll on our next test. Keep coming back. Remember to subscribe, like, comment, and share.